a drug like insulin, right? So insulin has an interesting history. Back in the day, there was only recombinant insulin, and recombinant insulin is an animal-based product. You just basically take an animal pancreas and just force it to kind of crank out insulin, and then you harvest the insulin, you put it in a vial, and somebody takes it, okay? Then what happened is pharma comes in and they create the insulin analogs. And the insulin analogs are really just about all the ones that we know at the moment. Like if you think about what are the insulins on the market, insulin analogs are the things like our glargine, our insulin lenti, it's the insulin asparts, insulin lispros that are working either for a very long period of action or a very short period of action. And then there's a few that have intermediate durations of action. Well, what the drug companies instructed their salespeople to do was to go out into different clinics and tell the physicians that the new insulin analogs were safer and more effective. And so and less allergenic. Okay. So they said, well, the recombinant insulins are animal-based products. Therefore, they're going to be more allergenic. We have greater control over the duration of action over the insulin analogs versus the recombinant insulins. And so they were able to say, look, we can prevent hypoglycemia while getting better consistency in the insulin levels along the way. So they're saying, look, it's safer, it's more effective, it's less allergenic. And then after they convinced physicians that this was indeed true with no evidence to back up that the new insulin analogs were any less allergenic, any more effective, or any safer at preventing side effects like hypoglycemia, they then 10x'd or even 100x'd the price of the insulin analogs compared to the old recombinant insulins.